is expected to decide on Wednesday whether or not the country will shift to a modified GCQ status in March.
The Octa Research Group reports that Metro Manila is seeing a slight upward trend in new COVID cases.
The Department of Health recorded more than 2,200 new COVID-19 cases today.
Hindi na po talaga tama na nagla-lockdown ng malawakan. Ang dapat po dito, ang sistema ay nakatalaga upang tukuyin kung saan na ang nagkakaroon ng sustained community transmission.
Malacanang says the president will decide if the whole country can shift to modified general community quarantine or MGCQ only if the COVID-19 vaccines have arrived and the vaccination program is in full swing.
Meanwhile, despite the much delayed vaccine arrivals, healthcare professionals have cautioned the government against moving to MGCQ as well. When can government ensure the delivery of COVID-19 vaccines? We discuss in this episode of The Chiefs.
And welcome to this Monday edition of The Chiefs. With us, of course, on set is Robbie Lampay of One News. And also with us online is Lucy Cruz Valdez, the head of News 5. And join us in a few minutes will be Ana Marie Pamentuan of the Philippine Star. Lucy, Robbie, happy Monday.
Hello,
Monday.
hi, happy Monday.
Yes.
Hesitatingly, but yes.
Hesitatingly. Well, if we were to look at the original targets, it should have been a happy Monday because the next day would have been vaccine day. I mean, the original target was February 23 for
I know,
the
yeah,
Sinovac
kailan
vaccines
ba
of
talaga
600,000.
yan, ano? Oh, wow, we're really all crossing our fingers that that happens soon.
Parang yung ating Valentine's Day date na February 15, na heartbroken na naman tayo. Although, yun nga, nabigay na yung
Nabigyan ng EUA, and now China is saying, just give us 5 days and ready na.
Okay,
Let's see.
Yeah. Yun lang, Sinovac talaga ang unang dumating.
Minsan parang, after you've been set up and disappointed so many times, parang ayoko na maging excited about it anyway.
Parang Valentine's card lang yan eh. Wag mo iasa sa PhilPost kasi late darating.
But now there's additional context and urgency here because now the president is saying this whole thing about MGCQ, the on-again, off-again MGCQ is off again. And the president is saying na hindi, we start with the vaccination program until we get that on track. Walang usapan ng MGCQ.
And looking at the numbers, you were reading the numbers kanina dun sa the big story, and the numbers are pretty good in other countries.
Yes.
You have what,
1.8 million or something like that in Indonesia.
Yeah. 60 million, I think, in the US, 40 million in China. So 205 million people already vaccinated all over the world.
Yeah.
That's around 2.4-2.5% of the world population.
And interestingly, even Myanmar na nagkakagulo ngayon, nag-umpisa na. They have a few hundred thousands already underway sa vaccination.
And Bangladesh too.
Bagal nyo kasi.
But, well, alam mo, matagal pa naman April 1 eh. So, pag pinangako sa atin April 1, doon kayo mag-ano.
April 2, first day.
We'll see. Hindi naman natin yunahan. I mean, like you said, Sinovac says maybe in 5 days.
5 days, yes.
Bigyan palugit another 2 days. So we're looking next week where we'll be.
I understand Malaysia received its vaccines yesterday, and Singapore is about to start vaccinations tomorrow of those 70 years old and above.
Australia also started already. Yeah.
Okay, let's go. Let's bring in our first guest. Although wala pa si Ami, but si Ami mamaya, humabol na lang. Our first guest for tonight is Dr. Maricar Limpin of the Health Professionals Alliance Against COVID-19. She's also the Vice President of the Philippine College of Physicians. Dr. Limpin, thank you for joining us and welcome back to the Chiefs.
Welcome.
Yeah, good evening everyone, and hope that everybody is doing well.
Yes po, we also hope that you are doing well. Doctor, I'm sure you've heard already about the President's decision not to declare MGCQ yet, which was originally being pushed very, very strongly by the economic managers of the country. So the President says firmly, wag muna. Kayo po, what is your group's position on this? Are you breathing a sigh of relief?
Yeah. in
Oh, you are?
reality,
Oh.
yeah, yes. In reality, we are all for it. We are very supportive of what the president's decision had been, no, as far as the community quarantine. Kasi if we do shift from GCQ to MGCQ, that will mean shifting the responsibility of protecting our the Filipinos on ourselves na rin, ano? And the main question is, are we equipped enough or empowered enough to do it? So I don't think that we are actually ready, kasi marami sa ating mga Pilipino, mga kababayan, kung mapansinin na natin at this point in time, they are not using their face mask and face shield, and they are not maintaining physical distancing. So yun yung minimum health protocols na dapat na na sinusunod natin, and many of us are not doing it anymore. And that's why we see, di ba, increases in the number of COVID-19 cases. Sa ngayon, we're more than 2,000 cases, no, in a day for today. So that is higher than last week. So I think we need to improve our self-protection, and we also have to make sure na yung transportation natin para sa mga tao
Right.
will
Yeah.
also be safer.
And you have not even mentioned the variant, no? I mean, the fact that there are now 62 infected with the UK variant, that's a big factor. And there doesn't seem to be a definitive end to that yet, no? As a matter of fact, the sense is it's just starting, no?
Yes.
So it's really alarming.
Yes.
But okay, so the question is, I think what you've just confirmed is that it's more the economic cluster, siguro, within the IATF that basically pushed for the MGCQ, right? But
Right,
can
yes.
you, so can you give us a context as to how much it's going to cost us if we were to push through with the MGCQ in terms of healthcare once again?
Yeah, ang problem, no, if we really push for MGCQ and we're totally not prepared for it, no, yung Filipinos are not prepared for it, the transportation system is also not prepared, and also I'm not going to mention anymore yung contact tracing, no, which we seem to have already forgotten, and it's an important part of the preventive process, no. So eventually, we might actually be seeing an increase in the number, more increases in the number of cases of COVID-19. And with the, as you said, the 62 COVID variants that we have already recorded in the country, it is highly possible that the transmission of these variants is actually much faster
Yes.
than compared to the standard COVID-19 that we have had in the past. So, mas maraming tao ang magkakaroon ng COVID-19, and therefore, that can actually bring about more. No, we will be deluged again with so many patients, no, in the hospitals, and that again will also eventually redound on the economy. So instead of pushing forward the economy, it's even going to cause a breakdown in the economy again, because that means that we need to again put our Metro Manila into lockdown. So eventually, mas malaki ang effect niyan.
Dr. Limpin, the other big news today is Sinovac is coming. Binigyan na ng EUA, ng FDA, the medical experts, the frontliners, everybody has said, look, basta may magdaan sa protocols, basta inaprubahan ng FDA, we're happy with it. So, is it really that simple? Are our frontliners relieved as well and happy? What's their outlook now that Sinovac is coming?
Yeah,
But it's not going to be administered to health workers.
Yeah,
I mean, just a qualification.
Oh, yun din yung itatanong ko
Yeah.
mamaya. But I just want to ask first, just this general, we'll have our first round. It's gonna be Sinovac. How do you feel about it?
Yeah, again, no, I'd like to remind everyone, especially the Filipinos, that the approval of the FDA to Sinovac, the EUA that was given by FDA means that it can be considered for procurement by government. So, kailangan dumaan pa yan sa proseso. So, the Health Technology Assessment Committee will have to look at it again and then try to see if it will be cost-effective for us to purchase, for the country, the national government, to purchase the Sinovac.
so hindi
Yeah,
pa
but
pala.
Doc, let me jump ahead on that premise. I think we understand what you're saying. May proseso pa rin yan. But let's cut
Yes,
to the
right.
chase. Bibili niya ng gobyerno. In fact, it's going to be donated. Di ba? So that's going to be the entire premise here. And if you read what has always been the very open body language and expressions of government, Sinovac is entering. There's no question about that. So, just jumping straight to that, and I'll take on Luci's question now, at this point. Because government also said, papasok yan, gagamitin na, but specifically not for the medical frontliners. And they are citing that the efficacy of this, if you look at the numbers from Brazil, is underwhelming. It's not that high. What exactly is the public supposed to take from this? I guess that's my question. Because on the one hand, sinasabi, eto na, pero yung mga doktor natin, mga nurses, wag muna natin bibigyan, ha? I mean, how are we supposed to feel with that kind of seemingly conflicting messaging?
Yes, I think medyo mahirap yan. So as far as, like let us say, if government is going to procure it, of course, kailangan dumaan pa yan sa proseso. But if there is one who is going to donate, then maybe one of the issues there will be if and when it is given to the public or to anyone, no, to any of the Filipinos who will be accountable to the possible adverse events, no, adverse effects that may be encountered, no, through the process. Like let us say, kunyari, magkaroon ng mga allergic reactions or any side effects, no, who will be responsible for that? No? So, yun yung isa pa na dapat na titignan. So, it's not really an easy issue na once na merong mag-donate, ibig sabihin, tanggapin. Of course, tatanggapin, but maybe sino ang responsible pag may mangyari doon sa mga tao? I would presume kung sino yung nag-donate, siya yung responsible. Unless magkakaroon ng waiver sa indemnification.
Yes.
No? So, that means it will be the government who will be accountable.
Doc, but what are we missing out on here? Kasi clearly ayaw ng gobyerno ibigay sa health workers. On the other hand, we were being told for several months na basta ma-approve ng FDA, pare-pareho yan. Now we have a contrasting point of view still from the government. So, yun nga po it goes back to that what are we not understanding here as far, kumbaga, bakit yung Sinovac ayaw nila ibigay sa health workers? What is it exactly with Sinovac?
Now, I think I'm not very sure because I have not really seen the full report of the phase 3 trial of Sinovac. Well, hindi pa ho namin yan nabasa in any of the journals. I think that was just given to the FDA. So I need to be able to see for myself and then analyze the data and then really find out if it can be indeed given to the Filipinos, no? And also be assured that it is not just effective but also that it is safe. So far, from some of the, from what I have read, it has about 50%
50.4% efficacy against mild and asymptomatic infections.
Yes, so ang ibig sabihin, it actually fulfills the requirement that has been
Of
set by
WHO.
the WHO.
Barely.
Yeah, barely. Yes. But I think even when I participated in the focus group discussions, no, on vaccination, COVID-19 vaccination, actually in general, most of us health workers actually believe that if there is a vaccine that is higher than 50%, I think it is best that we give the ones that have higher
Yeah,
effectiveness
exposure.
compared to 50%. But if there is really nothing else, and it's the only one that can be that we can afford, that the government can afford, then beggars cannot be choosers.
I'll bring in Ana Marie Pamintuan of the Philippine Star joining us online, Ami.
Ning doctor. Doctor, pero ano yung mood niyan? Kasi in-announce ng Malacanang na hindi nga daw kasama muna health workers dito sa donated vaccines. Meron bang resentment noon? Ano bang general attitude? I'm sure you've been talking among yourself, the health professionals. Ano bang attitude toward China? Meron bang resentment dyan kung mauna man? Basta hindi uunahin yung health workers as promised. Basta mauuna kayo dun sa 117,000 shot from Pfizer. Siguro in-issue din ng gobyerno, ewan ko. Pero will there be resentment among the health workers kung hindi kayo mauna dito sa Sinovac? Based on your informal
Or any other emotion other than resentment.
Do we hear a sigh of relief, in other words?
Yeah, first and foremost, I think ang una talagang kasi that was planned to be given to healthcare workers, and that based on the ones that were approved initially by the FDA and also by the Health Technology Assessment were the vaccine of Pfizer and also the one by AstraZeneca. So I think as far as the healthcare workers are concerned, these will be the vaccines that will be given to us, no? But well, personally, we have not really talked about this among ourselves. Honestly, this is the first time that we were able to hear the approval of the FDA of Sinovac. It was just we just heard the announcement just later this afternoon. So we have not really talked about it among ourselves, but I think that personally, I do not like to be hearing that Sinovac will actually be given to the Filipinos but not to the healthcare workers. Parang meron kasing double standard, Well, that is my personal opinion. So I do not want to have double standard when it comes to health. Kailangan kasi in health, there should be equity for all. No?
Yes, but
So,
Doktora,
hindi
yun yung isang concern, di ba? There is
Yeah.
there's safety, there's efficacy, there's actual supply, there's having to pay for it. And then on top of that, the one real emerging issue is confidence. And we know that confidence is very, very low. We know that people don't trust, particularly vaccines from China. What effect will this have on our public, on the general public, hindi na sa frontliners, but on the general public, when they see this, and it will in fact play out in this narrative, na eto na yung Chinese vaccines na wala akong tiwala, pati yung mga doktor ko, hindi bibigyan.
Well, doon sa statement na yun, syempre parang meron ding problem talaga, no? So, I think the trust and confidence, as you say, Robbie, is really a big issue. And we already reminded this of this particular issue, this particular concern, that the trust and confidence, if it becomes very low, will probably have an effect on the vaccination rate of the Filipinos in the country. So that will, in effect, affect the main objective of the program, and which is to achieve herd immunity. If we are not able to achieve herd immunity because of low vaccination rate, then we will always be plugged with the problem of COVID-19. So yung effectiveness of the vaccine being an important preventive measure, mawawala yon because we are not able to achieve herd immunity.
Dr. Limpin, what do you make of the stand that Cebu Governor Gwen Garcia is making right now, to the effect that she is going to go on MGCQ, even though the number of cases in the province is rising. And she said in her interview, or in her press statement actually, that she does not believe that a lockdown or any form of it, like ECQ or GCQ, has really been effective, saying na bakit nag-zero case ba nung nag-lockdown? Never. So, she's just going to open up Cebu to any tourist as long as there's a medical certificate, no more testing
Wala nang
required.
RT-PCR testing.
Yes. And I think she is echoing the sentiments of more and more Filipinos who now believe, I think, if you read social media, that COVID is not really as dangerous or fatal as they had us believe. Your thoughts on that?
Well, madaming beses naman na si Governor Garcia has been on opposite side, no, as far as the healthcare is concerned. So, the Cebu government has been promoting Tuob, no, as a means of preventing COVID-19, and definitely it has been shown not to be effective. There's no scientific basis for that. Sinasabi din niya na magtakip na lang, madami pa siyang mga ibang so which is exactly opposite of our position. So it's not surprising that she will again be on opposite position as far as placing Cebu on quarantine, on particular quarantine measures.
But are you concerned? Are you concerned with that? Are you concerned with her intent to relax all these measures and push forward opening the economy?
Yeah.
Of course, no, kasi if the people are not ready, as I said, no, to observe the minimum health protocol, no, katulad nga sinabi ni Lucci, marami ng tao they don't believe anymore, no, on lockdowns. They don't also believe anymore on face mask and the physical distancing, no. So you look at our numbers, it will never really go down because we have a lot of people, a big number of people who are not practicing the health protocols, and that is why we still see this number of cases, no, going up, and we are not able to really contain the pandemic. So, yun ang nagiging net effect, no? If we have people like this, then we will never really be able to put a stop into this pandemic.
Okay. Well, Dr. Maricar Limpin of the Health Professionals Alliance Against COVID-19, also Vice President for the Philippine College of Physicians. Dr. Limpin, maraming salamat po for joining us tonight.
Thank you, ma'am.
Salamat, Doc.
Yeah, and
Ingat
good
po.
night, and take care, everyone.
Take care din po.
You
We will just go into a break, so please stay with us.
The FDA has finally approved emergency use authorization for Sinovac shots. The announcement came after more than a month of stringent regulatory review, with the FDA asking Sinovac to comply with all of the requirements.
We were hoping sana last week and maybe even today masabit na yung documents kasi we're mindful of the February 23 na promise, right? And in fact, parang I heard pwede naman daw sila magpadala dito sa atin on the 23rd pending the approval ng FDA. But may complication yan kasi if it comes here without an FDA approval, Bureau of Customs is forced to seize the goods.
Sinovac are expected to arrive this week after getting an emergency use authorization from the FDA. But there might be some tweaks to the vaccine priority list as the China-made jabs are not recommended for healthcare workers.
Yung safety profile niya is good. Yung mga adverse event po nito is mild to moderate. The usual po, na pananakit sa braso, konting sinat, at ang rating po niya ay maganda doon po sa allergy and anaphylaxis. Mababa po ang posibilidad na magkaroon ng allergy or yung severe allergy or anaphylaxis.
Welcome back, the Chiefs here on One News. We're now in the final stage of our conversation. Now joining us is Dr. Rontgene Solante, infectious disease expert at the San Lazaro Hospital. Good evening, Dr. Solante.
Hi, good evening.
Good evening, sir.
Good evening, Doc.
Hey, Doc, we're talking about Sinovac. May EUA na, papasok na. But maybe you could help us to understand this because, FDA has pointed out Sinovac data shows 65 to 91% efficacy, but they're also citing, Dr. Domingo, Yusek Domingo is citing that in Brazil, trials involving healthcare workers, 50.4% efficacy lang. So, now, tied in with that is government's clarification, pagpasok ng Sinovac, explicitly, it will not be for healthcare workers. What exactly is the concern here? Bakit po hindi ibibigay sa healthcare workers?
Okay. Now, if you look at clinical trials like the Sinovac, there are 3 sites here. The Brazilian study was the one that was initially completed. And yung mga participants dito are high-risk healthcare workers. And they are the ones seeing COVID patients every day. Now, if you compare the 50% efficacy, so that only means that you still have a higher 50% risk of getting the infection. And in fact, your risk there is already high. You'll be getting this vaccine. So that's an example of how we should position vaccine based on the efficacy and the target population. And that's really important when you look at efficacy and the target population. Now, in the Turkey and the Indonesian trial, this involved non-healthcare workers, or in fact, if there were healthcare workers in the Turkey trial, they are still the high risk, but number of participants were low compared to the general population. So which means you have a higher efficacy rate in the general population compared to those with high-risk healthcare workers.
Doc, you're an infectious disease expert. Very quickly, baka maybe just explain to us, bakit po yung iba yung efficacy dito sa mga high-risk, highly exposed medical workers versus the rest of us?
Yeah, because that's how the vaccine works. No, it has several different efficacy in a different population, and in this particular study, they found out that the efficacy among these high-risk healthcare workers is really low. We have to accept that efficacy rate, and that's the beauty of a phase 3 clinical trial. You'll be able to know and look at how effective or how the efficacy of the vaccines in different target population.
Hindi ba yung efficacy is dependent on the level of is it dependent on exposure? Hindi ba depende yun sa infection? I mean, some vaccines work better in severe cases, yung iba mild cases. Hindi ba yun yung hindi yung sa risk? Hindi ba sa risk yun?
The primary objective of the trial here in most trial is how effective this vaccine in preventing any symptom of COVID. So regardless of mild, moderate, and severe, nandun yan, kasama yan. And then they will just do a analysis if how many of those were prevented from getting the severe COVID or the moderate COVID. But the 50% is the overall efficacy. In the Brazilian trial, all of the participants are healthcare workers who are seeing patients every day. Okay, and that alone, the 50%, that's the overall efficacy. So for me, I don't think that that's quite a low vaccine efficacy for it to be given in the health frontline workers who are seeing patients, COVID patients a day.
Doc, you're saying, Bale, that efficacy is also a factor of exposure to the virus. It's not necessarily a factor of severity of the illness. Tama ho ba?
No,
Am I getting right?
no. Efficacy is a factor of how our body
Reacts.
produce an immune response to a particular infection. So meaning, out of 10 given the vaccine, and the other 10 did not receive the vaccine. In this particular study, they found out that 50% of those who were given the vaccine did not develop, and 50% of those who did not receive the vaccine, 50% did not develop. So mukhang merong 50-50 ang efficacy niya.
Doc, we're asking this because also, we are also mindful that pagka lumabas to sa balita, as it already is now, people will be cynical about it. They will look at the 50% being reported and so on. But one of the bottom line things that people need to understand at this point, if I'm understanding this correctly, is if you qualify as a candidate to receive the first shots of Sinovac, you're not talking about a 50% efficacy. Your chances are actually 65 to 91%. Yun yung numbers na pwede mong panghawakan.
Yes, that's for the general population. So these are the low-risk population, meaning they're not seeing COVID patients a day. Ganito kasi explain lang natin for content. Pag ikaw yung frontliner and you're seeing patients a day, yung risk mo seeing patients a day, siguro 50 to 60% you'll be getting COVID the first time, second time, third time. But if you're in the general population not working in the hospital, your risk is really lower than that of the healthcare workers. Now, in this particular study, the risk for those with high risk of getting COVID is only 50%. Those with low risk of getting the COVID is higher. So, ilagay natin doon kung saan siya mas mataas ang efficacy.
Okay.
Okay, so you think that this is a fair deal to give Sinovac to the general population and not to the health workers? That's essentially what you're saying.
Yes.
Okay.
Okay, so we shouldn't worry about it. Now, the next question really will be for the general public who will be given that. Do you think it will be safe for us to go into MGCQ or loosen up the restrictions just because there's already a Sinovac vaccine that was administered to a general population, no matter how few?
Okay,
Does that help?
no, so let's put it this way. It doesn't always be, it will not always be safe unless 60 to 70% of the population are getting the vaccine. Okay, you're just talking about 10 or 15 of us in a community getting the vaccine, and then we will be going out. Even if that's a Pfizer, a Moderna, or a higher efficacy vaccine, that will not help. We need more people to get the vaccine.
So in short, we're a long way off to herd immunity, right? So, okay. So I guess the next question is, what if it takes us a year to actually complete the vaccination of 70 million Filipinos? I mean, is it going to be safe enough to loosen up as we increase the numbers? Is that how to best go about determining whether to loosen up or not? Medically.
The indicator for loosening up the quarantine, the lockdown, is when we also will roll out the vaccine, we'll also be monitoring the daily cases. And if the daily cases will also be going down while we are increasing the vaccination rate and the daily cases are also going down, that's a good sign. So meaning, on that aspect, there is now a rolling efficacy of the vaccine, that it's working for months from now, 6 months from now, until we get that number of population, proportion of the population getting the vaccine.
Doc, let me back up a bit.
Isn't it a fact that the vaccines don't really prevent transmission.
No, no. So I'll have to correct that, no?
So it does.
Yes,
Oh,
because why will you not prevent the transmission when you don't have the symptoms, when you don't develop the severe infection? Remember, when you have severe infection, when you have moderate infection, you have higher viral load. That means you can infect anybody. Since this
yeah,
vaccine
you become a
prevent,
super spreader.
yes,
Yeah.
this vaccine prevent you from having the symptoms, then that will less make these people being transmissible, or that the virus being transmissible.
So in that sense, it does help prevent transmission.
Yes.
Okay. Doc, just some clarity there kasi I looked it up on WHO websites where they publish they publish their FAQs on the various vaccines, and almost all of these vaccines in the WHO website, the WHO says that there is no data that shows that nare-reduce yung transmission ng mga bakunang ito
Yun nga eh.
because
Yeah.
because that we don't have enough time yet to figure that out.
Correct. And at the same time, these vaccines are not even designed in the phase 3 clinical trial to look at reduced transmission. Yeah. So that's why we base
So we're not sure. We're not sure.
But when you surmise that if you prevent an infection, when you prevent a symptomatic infection, that also goes with it. That you'll not prevent.
Ang ibig niyo po sabihin, Doc,
okay.
kunwari, hindi siya inuubo ng malakas, therefore, mas maliit ang tsansa na makapanghawa siya. Pero he's still contagious. I mean, he can still transmit the virus, except na hindi siya umuubo.
No. Because when you prevent the virus from entering the cells, you decrease the number of the virus in the cells. You decrease the ability of the virus to multiply. And that alone will lessen the load of the virus, then less for you to transmit the infection.
Bumababa talaga yung risk. Ano naman, doctor, yung long COVID? I understand na minomonitor nyo na rin yun dito sa Pilipinas. How serious is the problem? Kasi marami kayong cases sa hospital nyo. Yung ba yung kaso ni Secretary Anyo? What happened to him na?
I'm not so privy about the case of Secretary Anyo, but we see a lot of our patients that still having symptoms, compatible with COVID, that lasted even after the day of their admission, even after the discharge, like easy fatigability, shortness of breath, and sometimes they have depression and loss of focus and decrease in the memory.
So anong impact ng vaccines dyan sa ganyang klaseng COVID?
Well, of course, if you prevent them from getting the infection, then you'll not go into the complication also.
Pero kung nagkaroon ka na and you have long COVID, pwede bang parang treatment yung vaccine?
Yeah, the vaccine, even if you have recovered and even if you have that long COVID, you can still get the vaccine. That the vaccine is not contraindicated among this population.
I mean, Doc, speaking of treatment, we've been spending a lot of time talking about vaccines, and hopefully we can prevent people from But are there developments on the treatment side na hindi necessarily bakuna yung dine-develop? Meron bang mga excitements dyan na dapat pansinin din natin?
Yes, there are. No, in fact, one of the most promising treatment now is the monoclonal antibody. So this is a form of synthetic antibody that will also bind to the spike protein of the virus, so that when given early part of the symptoms, will prevent these patients from going into more moderate and severe form of COVID.
Yan ba yung ivermectin ba yan? Yan yung mga naririnig namin, iba yun. Kasi that's what's being pushed, I think, in the US, no?
No,
ivermectin.
Ivermectin has not passed through that level of being recommended in the US.
Okay. So we're not even studying that either, I guess. No.
But yung blood thinners, are we trying them out? Yung blood thinners as treatment?
No. The blood thinners are only given to those who had the COVID and to prevent the embolic complications of COVID.
So,
yung gamot na Doc, yung for parasites, parang ganun, for animal parasites, I think that was also explored, right?
Yung antimalarial dati.
I remember that. Yeah.
Yung anti-malarial, yung
Is it remdesivir? No?
chloroquine,
Hydrochloroquine.
chloroquine.
Yes.
So, but it did
Yeah.
not also pass that when during the trial there was no benefit that when
So wala pa rin.
Wala.
So as far as cure, wala. Talagang right now, the only hope is vaccines.
yes, correct.
And health protocols.
Doc, let me back up a bit. I'll go back to yung Sinovac. Was it only Sinovac that conducted the trial exclusively for healthcare workers? Kung saan siya nag 50.4% na efficacy? I asked that po kasi kung siya lang, and I don't know kung siya nga lang, pero kung siya lang kasi, that means that we don't know if Pfizer or Moderna or any of these other vaccines will be any better for healthcare workers kung they did not do the same test for exclusively for healthcare workers.
The AstraZeneca trial, where most of the participants also are healthcare workers.
Okay.
In the Pfizer Moderna, there were also healthcare workers part of the clinical trial.
So we have comparative studies, in other words.
Yes.
Doc, ako sa kabila naman ng tanong na yun, not with respect to other pharmaceuticals, but other demographics. Are there other target populations that data suggests, apart from medical health workers, hindi yata, wag nating umpisahan dyan sa target population na yan?
Okay, if you look at most of these trials, they also look at 60 years old and above, no? Kasi ito yung population at high risk of mortality. And then they also look at how effective the vaccines are across all ages. So from the younger age group to the older age group, across race and ethnicity, and underlying medical conditions like hypertension or diabetes. So these are all part of the objectives of the trial. If there is really equal and higher efficacy regardless of your age, regardless of race, regardless of the presence of comorbid conditions. And these are some of the important aspects of a good vaccine that we should also be looking at. Not only the ability of the vaccine to prevent COVID and prevent the symptoms.
What about comorbidities, Doc? I mean, halimbawa, I have autoimmune, no? Pwede ba ako sa vaccine?
Yes. So there is no you are not contraindicated. There's no contraindication for those with autoimmune for comorbidities like hypertension, diabetes, other comorbidities, or even immunocompromised, no? But on the note
No, for example, lupus, ganun.
Yes, you can.
Well, okay yun.
Yeah, so
Okay.
there are no contraindications for that, no?
Okay, all right.
Okay, Dr. Rontgene Solante, infectious disease expert from the San Lazaro Hospital. Maraming salamat, Doc, and thank you for joining us.
Salamat
Thank you,
po.
Doc.
Thank you. Stay safe.
Stay safe din, Doc. Okay, that was Dr. Solante. Let's now talk to the head of the Pasay City Health Office Epidemiology and Disease Surveillance Unit, Mr. Miko Llorca. Mr. Llorca, thank you for joining us and welcome to the Chiefs. Mr. Llorca, can you hear us?
Wala yata.
Okay, we're
Wala
still
pa
trying to
si
get
Mr.
Mr. Llorca.
Llorca.
Mukhang kailangan ng pasalood.
Oh, but we want to talk about Pasay City kasi
34 barangays under localized community quarantine.
Naka-lockdown
Oo.
ngayon, 34 barangays.
Yeah.
Tumaas yung cases. Oh,
Tsaka within 2 days.
mm.
I mean, February 18 to 20, parang ganun. Eh.
It was just it
bilis
was
eh.
28 last week, 'di ba? Pagkatapos over 3 days 86 yung
Oo.
yung so biglang pumalo yung number sa Pasay.
Yeah.
That's
Thing
why-
with Pasay kasi
Yeah.
dikit-dikit yung mga tao dyan eh. It's
Oo.
really crowded
Di
in
naman-
some places in Pasay City. Well, some
Di
places.
naman siguro sila nagpiesta or nung Ash Wednesday.
Well,
baka
minsan di mo kailangan magpiesta eh.
Sabay-sabay silang nag-ano.
Alam mo naman, pag pumunta ka sa Pasay, talagang may mga lugar dyan na talagang dikit-dikit. Hindi mo kailangan magpiesta. Malapiesta ang lugar kahit gutom yung mga tao.
But ayun nga, we don't
Pero
wanna
kasi bakit ngayong February
Yeah.
yung nangyari,
Yeah.
di ba?
Yeah.
I mean,
Diba?
it makes you wonder what, there must have been something. I don't
parang
know.
may sinasabi ka, ano ba meron sa Pasay? Ano ba meron sa Pasay?
Tapos Valentine's pa.
Alam mo yun. Kaya
Ano bang
nga
meron sa
tinifigure out
Pasay
ko nga.
pagka-Valentine's? Fiesta?
So, kung ganun, ipasig din, ganun dapat.
No, but we,
Iba
I
dati
mean, in all,
may ano?
in all
Di ko lang
seriousness,
kung
we don't,
nakagets ng pinag-uusapan
in all
natin.
seriousness, we don't want to speculate. Ito na yata si Mr. Llorca. Mr. Llorca, are you with us?
Yes, sir. Magandang gabi po.
Okay. So, I put us right. We want to be serious about this. We're reporting, we're seeing reports na tumaas po ang cases dyan sa syudad nyo. What is happening, sir? And we take note also, 34 barangays in localized community quarantine. Kumusta po sa Pasay?
That is correct, sir. Nagkaroon po kami ng sudden peak po ng increase ng cases. Nag-start po ito nung nagkaroon po kami ng intensified contact tracing, then nagkaroon po kami ng isang so intensify po yung contact tracing namin. We are contact tracing up to the third generation of contacts. Nagkaroon din po kami ng mass testing po sa mga barangays po namin. And ang pinaka nakita po namin dito, base po sa pag-aaral ng data namin, 66% po ng mga kaso namin ngayon ay magkakasama po.
Sorry, Mr.
I'm sorry po,
Llorca,
medyo
naputol
it was broken. Magkakasama po sa... I think we lost him, but something crucial there, di ba? Parang 66% of
Parang magkakasama sa bahay.
magkakasama ba sa bahay?
Ganun kalaki, baka compound, no? I mean, oo.
Di ba kayo mga
Yeah,
community na matisikip yung
That's
sinasabi?
two-thirds eh.
Oo, talaga napakasikip doon eh. Papasok ko sa maliit na kalyat to enter a compound na parang mga condominium style yung, ewan ko kung yan sinasabi nilang community but it's a condominium style dwelling na multiple families are living in the same structure.
Yeah, tama. Pwede. You're not necessarily one family in one structure eh. Pag sinabi ni Mr. Llorca na magkakasama sa bahay, that's not necessarily to mean na isang pamilya lang yan. Maring several families in one condo type structure. Mr. Llorca, Kaniras.
Yes, hello. Good evening.
Element.
Tama, dinig namin po, 66% ng mga na-infection ay magkakasama sa bahay po. Tama ho ba?
Yes po, opo. 66% ng active cases namin magkakasama po sa bahay. And
Anong bahay po yan?
Iba-iba po, ma'am. May compound, may
Okay.
bahay po, and may condo. So, because of this reason po, nag-request na po kami sa DOH ng genome sequencing of our cases.
Bakit po genome sequencing? Do you suspect any variant?
Yes, actually, dahil po sudden peak, sudden increase ng kaso, tapos unlike po before, dati naman po pag nagkakaso sa bahay, hindi po nahawa yung iba eh. Ngayon po talagang naubos.
But can you, Mr. Llorca, can you trace it or do you suspect that there were crucial patients or cases that came from abroad?
Right now, wala po. All of these are local cases.
Okay.
Sila ho ba ay tinest on the third day, on the fifth day, yung ganun ba, bago nalaman? Or could it have been just a simple case of delayed reporting of test results? Di ba kung minsan ganun ho yun?
Apo, bali, sa office po kasi namin, pagka natatanggap namin yung case, within 12 hours to 24 hours, natatawagan na po namin yung mga kaso. And at the same time, nadadala na rin po namin sa mga isolation facilities namin. Most of our cases right now are cases tested outside Pasay and are reported to us by the DOH and other LGUs.
What do you mean po? Most of the new cases you have are tested outside of the city. Ibig sabihin, they're not there anymore. Tama
Hindi
ba?
po. Bale, taga Pasay sila, tapos punta sila sa laboratory outside Pasay or hospitals outside Pasay.
Okay.
So, marereport po sa amin yan.
Okay. I'll go back po dun sa sabi niyo 66% mga magkakasama sa bahay. Tama ba intindi namin na sa isang bahay o sa isang unit not necessarily one family lamang, kundi you have several families cramped or cohabiting within one dwelling?
Yes po. Correct po. Meron po kami isang compound. That's why we localized our lockdowns.
Yeah, but
Household and compounds.
yeah, but Mr. Llorca, just to be about that, okay, localized yung lockdown, but we're talking about, tama po ba, 34 barangays?
Correct po.
So bakit po 34 barangays? So are we saying that these are, hindi lang po malinaw sa akin, are we saying there is one specific area kung saan maraming pamilya, or are we saying we're seeing this trend of multiple families across 34 barangays?
Yes po. So in one barangay, pag nagkaroon ho kami ng 3 or more cases,
Ayun.
we are recommending that for localized lockdowns.
So apart from the localized lockdowns, meron pa ba kayong hihigpitan sa city? Any economic activities
Yes.
in particular, for example, or transportation outside the 34 barangays?
Well, number one po, nakipag-partner po kami sa PNP and other offices po ng local government para ma-implement po yung standard minimum health protocols po natin. At the same time, yung paglipat po namin sa mga isolation facilities namin, tuloy-tuloy po contact tracing and testing.
But to be sure, Mr. Llorca, hindi naman po bagong sitwasyon yung the fact na magkakasama sa isang compound or sa isang bahay, no? Ang tanong po bakit kaya ngayon lang nangyari yan na parang bigla na lang dumami sa isang lugar, no? Sabay-sabay. Meron no kaya nangyari niyan that may have triggered an outbreak of that magnitude?
Tama po kayo, ma'am, kahit kami po na nagulat din dahil sabi ko nga po kanina, hindi po kagaya nung dati na hindi naman po kumakalat lahat sa household. Kaya po nanghingi kami ng assistance kagad sa DOH para po dito malaman natin kung ano yung kumakalat sa amin.
Oh, okay. All right.
Okay. Maraming salamat, Mr. Miko Llorca, OIC ng Pasay City Health Office Epidemiology and Disease Surveillance Unit. Sir, mag-ingat
Thank
po
you
kayo
so
dyan.
much po.
Maraming salamat po.
Salamat po.
Good night po.
Good night po. And that'll be all for this Monday edition of The Chiefs. We hope our discussion will keep the conversation going. I'm Edwin Gao.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.